Do you have or know someone who has a prostate problem? Maybe your husband doesn't have this problem and doesn't even know it. I've put together a list of some symptoms that, if you have, could indicate a prostate problem. So start sharing this video with everyone you know. And you don't even need to share it just with men. No, many women can watch and ask their husbands if he has any of these symptoms. Well, now that I've given you my message, let's get to the topic of today's video. An enlarged prostate is a problem that tends to appear more frequently in men over 50 years of age. There are many symptoms that an enlarged prostate can generate, such as a very weak stream of urine, as if there was no pressure. In most cases, it is a problem caused by benign prostate hyperplasia. Dayan, what is this? Benign prostatic hyperplasia is an enlargement, not due to cancer, of the prostate gland, which ends up making it difficult to pass urine. Therefore, it is essential to consult a neurologist to perform a digital rectal exam and rule out the possibility of cancer, as this type of cancer can also enlarge the prostate. Stop with this stupid prejudice, because I can guarantee you that it's better to have a touch than to have cancer. How do I know if I have an enlarged prostate? The symptoms of an enlarged prostate are similar to the symptoms of other prostate problems. Do you have difficulty starting to pee? Is the urine stream very weak? Do you feel the urge to urinate often, even during the night? Do you feel like your bladder is always full, even after using the bathroom? Do you usually have drops of urine in your underwear? Do you have difficulty getting or maintaining an erection? Does the urge to urinate come on very suddenly? If you have one or more of these symptoms, the chances of having a prostate problem are high. At the same time, you can also have prostate cancer and not have any symptoms. The most requested tests are a urine test and or blood test and an abdominal or transrectal ultrasonography. Of course, in addition to prostate resonance. These tests can also help identify other diseases with symptoms similar to those of an enlarged prostate, such as urinary tract infections, kidney stones, urinary incontinence, and diabetes. Why do these symptoms appear? These symptoms usually arise in the case of the enlarged prostate because the growth of the prostate presses on the urethra. Urethra is the channel through which urines pass. This channel connects the bladder to the external environment. This is why men with prostate problems often experience difficult urination. But as I said, these could be symptoms linked to other problems such as prostatitis. And how is the diagnosis made? During the consultation, symptoms will be assessed and a rectal exam will be performed. It is the touch that allows the doctor to assess whether there is an enlarged prostate or whether there are nodules or other changes which could indicate more serious illnesses. In addition, the doctor may also order a PSA test, which is normally above 4.0 in case of an enlarged prostate. If, by chance, the doctor finds abnormal changes during the rectal exams, or if the PSA test indicates a value above 10.0, he may order a prostate biopsy. It is asked to evaluate the possibility of prostate enlargement being caused by cancer. What can cause an enlarged prostate? Most of the time, this enlargement of the prostate occurs due to benign prostate hyperplasia. Therefore, do not despair. This is a problem that arises with aging and presents symptoms of slow progression. In other words, it can take years before symptoms are actually noticed, and treatment will only begin when symptoms interfere with the man's quality of life. And if by chance the diagnosis is confirmed to be prostatitis or cancer, for example, you start treatment. Prostatitis tends to happen to younger men, while cancer tends to appear most of the time in older men. Now, if you have a family story of prostate cancer, you need to start having a digital rectal exam earlier than usual. I think that every man around the age of 40 should start having a rectal examination. What is the treatment like? Treatment for an enlarged prostate varies depending on the cause and severity of the problem. And among the most common cause, treatments are benign prostate hyperplasia, treatment with the use of medications such as finasteride, as well as salpalmetto and hormonal modulation itself, if a deficiency in sexual hormones is detected. The idea is to reduce the size of the prostate and alleviate symptoms. In more serious cases, the doctor may opt for surgery to enlarge the urethral space. This surgery is known as transurethral resection. In case of prostatitis, inflammation normally occurs as a response to a bacterial attack, and therefore the doctor may prescribe antibiotics. Prostate cancer treatment usually involves surgery to remove the prostate, and depending on the evolution of the cancer, it may be necessary to undergo chemotherapy or radiotherapy. As this type of cancer has a long natural story, depending on age, nothing is done. There are urologists who say that if every man lived to be more than 120 years old, he will die from prostate cancer. There are some natural remedies that can help complete the treatment and can alleviate symptoms more quickly. This is the case, for example, with tomato juice or pumpkin seeds, but everything needs to be discussed with the doctor. Now that you understand the main reasons for an enlarged prostate, share this video with all your WhatsApp groups and leave a like. Don't forget to leave your comments and be present on the channel in whatever way suits you best. And live healthily, live with passion and with God in your heart.